And welcome to ENZYMENTAL. I'm Jason Carter, and today I wanted to talk to you about the connection between insulin and breast cancer. Researchers and physicians already understand many of the risk factors predisposing women to breast cancer, like genetics, poor diet, inadequate vitamin D, high levels of endogenous estrogen, and synthetic estrogens in hormone replacement therapy. But type 2 diabetes, which is characterized by elevated blood sugar and insulin levels, also increases the risk of some cancers, particularly breast, colon, and pancreatic cancer also. Elevated insulin levels are common in pre-diabetes, type 2 diabetes, and obesity. However, about 1/4 of thin, apparently healthy people also have elevated insulin levels. So because of this, for millions of women, insulin may be a hidden risk factor for breast cancer. Type 2 diabetes is the endpoint of years of blood sugar problems, which often come in the form of undiagnosed pre-diabetes. If you tackle blood sugar problems early enough, you can eliminate your risk of diabetes and very likely lower your risk of breast cancer over time also. High levels of insulin-like growth factor 1, or IGF-1, are associated with a greater risk of breast cancer. IGF-1 is a peptide that stimulates cell growth and inhibits cell death, and these are traits that are perfect for fueling the growth of cancers. Cancer cells have a large number of IGF-1 receptors on their surface, making them highly responsive to high blood levels of insulin and IGF-1. Women with invasive breast cancer are more likely to have poorer outcomes if their cells show increased insulin and IGF-1 activity. So what exactly increases insulin levels? Normally, insulin helps to transport blood sugar into cells where it's either burned for energy or stored as fat. But when a person regularly consumes large amounts of sugary foods and beverages and sugar-like carbohydrates, what I call the standard American diet, the pancreas secretes so much insulin that the body cells become resistant to that insulin. To compensate, the pancreas releases even more insulin, but because it can't be used, both insulin and blood sugar remain at high levels in the blood. So, controlling your blood sugar and insulin means working to improve your eating habits more than anything. What you want to look for when preparing your meals are fresh, wholesome, real foods that are not packaged. Packaging usually indicates some degree of food processing, refining, or manipulation, and processing usually means a food's original nutritional value has been heavily compromised. You'll do better with organic and whole foods because they generally undergo less processing. However, you do want to be aware that organic sugar is still sugar, just like organic cereals are still refined carbohydrates, and both of these will raise your blood sugar and insulin levels. Quality protein is also essential for maintaining healthy blood sugar, as protein helps to lower and stabilize blood sugar for a variety of reasons. First, protein does not prompt a rise in blood sugar, and because blood sugar levels are more stable, protein reduces appetite, which makes it far easier to lose weight over time. Second, protein stimulates the release of glucagon, a pancreatic hormone that counteracts and lowers insulin. While insulin helps to convert blood sugar to fat, glucagon blocks this conversion. And while insulin promotes fat storage around the belly, glucagon helps to burn that fat. Third, protein helps to maintain muscle, which is the best tissue for burning blood sugar and fat. Preserving muscle mass becomes especially important after age 40, when age-related muscle loss rapidly accelerates. Like protein, fiber also lowers and stabilizes blood sugar levels, but it works through a different mechanism. Soluble fiber increases the bulk of foods, which reduces the appetite and slows the digestive process so blood sugar levels don't spike. And the good news is that most vegetables, especially raw vegetables, contain large amounts of fiber. Exercise is essential to maintaining healthy blood sugar, as physical activity lowers both blood sugar and insulin levels. The greater your activity, the better, but you definitely want to start slowly to avoid being discouraged. Make time for a daily walk, increasing your pace and distance over several weeks if you can. And you can also use hand weights and stair climbing exercises to increase your arm and leg muscles. It's impossible to completely eliminate your risk of breast cancer, as there are most likely risk factors that haven't yet been discovered. However, you can reduce your odds of developing this disease by controlling all the known risk factors, which include elevated insulin levels. There are also some supplements that help to control insulin and blood sugar, and these would include things like silymarin, which is an extract of milk thistle, and this has been shown to lower both blood sugar and insulin on its own. It works by enhancing liver function, and the liver works with the pancreas to regulate blood sugar and insulin. Chromium is an essential trace mineral needed for normal insulin function, and taking around 200 micrograms twice daily can lower blood sugar and insulin levels. Alpha-lipoic acid is an antioxidant that improves insulin function, meaning that less insulin is needed to do its job. Alpha-lipoic acid has also been used to treat diabetic nerve disease for decades throughout the world. And also Gymnema sylvestre, an herb known as the sugar destroyer, stabilizes pancreatic insulin secretions and also helps to restore insulin sensitivity over time. So this is something you definitely want to keep in mind for maintaining healthy blood sugar. However, one note of caution with Gymnema is that if you are taking supplemental insulin, you absolutely do not want to take Gymnema, as it heavily contraindicates with supplemental insulin. Thanks for watching. I'm Jason Carter, and I'll see you next time on ENZYMENTAL. Stay healthy.